I'm so fortunate to be a part of Cook Children's Medical Center. I came here about 13 years ago. And when I came here, we were just 4 or 5 child neurologists trying to eke out a living. And I've seen our practice blossom just like the medical center has.
The program has grown dramatically over the years.
So in one clinic visit, the patient can be seen by the neurologist, by a physical therapist, an occupational therapist, an orthotist to look at bracing and things like that, a social worker, a nurse.
We have a complete range of neurosurgical treatments here. One of my partners does hemispherectomies, we do complex spine surgery, we do vascular surgery, and of course, lots of brain tumors.
Most of the problems are so complicated that very few people can solve them unassisted.
The complexity of the surgeries that we're performing have increased dramatically.
The group at Cook Children's Neurosciences partners with each other, the patient, the family, and you, the referring physician.
It's very important to me that that referring physician is happy.
We have an enormous patient base. Between neurology and neurosurgery, we see just over 25,000 patients a year.
And to do some of these operations, you have to have the gear to do it. And you have to have well-trained people, but you also need the institution support.
We see a need and we decide what do we need to do to fill that need. And we make a plan and we get the support that we need to be able to fulfill the need to help the children.
And the board and the administration get it. They need the bottom line to support what goes on here, but there's no hesitation. There's not a discussion of, well, if that doesn't add to our profit margin, that has nothing to do with it. It's about what we can do to make care better for the kids.
Centered in Fort Worth, Texas, Cook Children's Neurosciences is one of the largest, most technologically advanced pediatric programs in the Southwest, focused on advanced treatment and teamwork.
The IMRI suite was one of the biggest things, other than the people, that attracted me to Cook Children's Hospital.
The intraoperative MRI has been a big addition to the epilepsy program.
In brain surgery, we can, during a procedure, take an MRI, a high-grade, high-resolution MRI of a child's brain, and know whether we have taken an entire tumor out, or whether we have more to work, or whether we're very close to something that can potentially have a neurologic effect to the child later on. And previously, those sorts of things had to be done after surgery. And now we have the IMRI plus the neuronavigation integrated systems that we can make all of those decisions minute to minute, multiple times during a surgery if we needed to. It has greatly improved the quality of care.
So far, we have not had the need to reoperate on children that have had the intraoperative MRI procedure done.
Cook Children's Neurosciences knows a successful outcome is a combination of skill, technology, and communication.
The success of our DBS program has been the willingness of everybody to work together towards the common goal. It requires patients that trust us, patients and families that we trust. It requires physicians and other providers who trust each other. In the operating room, we all talk to each other. The neurologists talk to anesthesia, Child Life talks to anesthesia, we all talk to the neurosurgeons, we talk to the patients.
What really attracted me to this hospital was that we were shown such a collegial environment. There was no egos involved, nobody was above anyone else, but more importantly, above the children. It is such a focus to really treat these kids, and because of that environment, everyone works together incredibly well.
Here, our neurologists and neurosurgeons collaborate on a daily basis, sharing office and operating space.
We collaborate frequently with our colleagues in hematology and oncology, with our neurosurgeons. We have excellent neuropsychologists with whom we work closely.
We collaborate on everything. We see each other every day, almost all day, every day.
If I have a question about one of my patients, I can just walk to the office next to mine and ask somebody else's opinion. So frequently, if we have a very difficult child, just by seeing one physician, that child has had 3 or 4 different opinions in one visit.
A doctor who works with good doctors is a happy doctor. He or she will be better adjusted, will do a better job, will have more professional development in the sense of will be more able to learn.
Because the education never stops. I can always learn something from either one of my partners. I can always learn something from my nurses. I can always learn something from anyone.
And you need that interaction with your peers very much so in order to stay current.
It not only enhances the breadth of what we can handle at our hospital, but it also makes the depth of involvement much greater.
Our focus on pediatric deep brain stimulation, epilepsy, and neurorehabilitation is redefining the future for children with neurological and neurosurgical disorders.
It's very unique to find this many physicians, this many neurologists, neurosurgeons, neuropsychologists who work together, get along together, and I've spoken to many, many colleagues across the country who are so jealous that we are actually in the same clinic, the same offices, the same building, and have this integrated department.
It's not even a network, it's more like a mesh, to certainly catch every possible thing that could happen.
So I've seen a great deal of change over the past 13 years that I've been here, and I can't wait to see what's going to happen over the next 13 years.